Hello, I'm Andrew Walton. I'm a shop steward in the NHS. I'm a Unison member. This is in a personal capacity. I just want to talk about some of the experiences working in the NHS. I work in mental health, and we answer phones to people all the time who need support with common problems like anxiety and depression and stress at work. The NHS is trying to keep up with demand as best as it can, and we're doing our best as staff, but services are very, very stretched, and it only increases the stress of vulnerable people when they try to access services. We've actually noticed a dip in referrals to our service as people simply aren't able to get through to GP surgeries and access things because of the coronavirus situation at the moment. Care has been largely shifted from the social care to individuals in many cases, with huge cuts to care budgets being made by councils and elderly care homes being closed as well. And this pressure of this pandemic will only add to that stress for many people. People face the uncertainty of working under 0 hour contracts and simply not knowing where the next pay packet is going to come from, or the possibility of being laid off work as a result of this. And we've seen the Tories' response to the situation is totally inadequate to meet the needs of ordinary people. Capitalism cannot provide for our needs. We need to build a socialist alternative, and that's part of what I'm part of, the Socialist Alternative Party. It does what it says on the tin. We demand a nationalisation of companies who are in danger of going under. We demand full pay for all affected by this crisis. We demand a fully funded, comprehensive national health service as it was designed to be, free of charge and not subject to the whims of the internal market, where private companies are constantly bidding for services, and more of our NHS is being handed over to companies like Branson's Virgin Health and American companies who are just there to make profit from illness. The government's recent crumbs from the table, if you like, under huge public pressure, that they've written off some of the NHS debt, but this is totally inadequate. It isn't the huge PFI debt that trusts have run up that amounts to many more £1 billion than they're willing to spend on the NHS. And it was themselves who created this problem in the first place. The policies of New Labour and the Tory government is what made the NHS get so much into debt in the first place. And it's that we need to reverse. We stand for a socialist economy which would actually put the needs of people first rather than profit, and run the NHS as it was intended to be, comprehensive healthcare for all. We've faced decades of underfunding and understaffing in the NHS, and that hasn't really changed as a result of this pandemic. But what is a constant is the willingness of people to go the extra mile, to put themselves at risk in many cases, and the government haven't actually provided NHS staff with the proper, much needed personal protective equipment that they need to do their job safely. So unions and parties should be putting as much pressure on the government as we possibly can to fight for safe working conditions. And also we need to stop the uncertainty and stress that people face as a result of this crisis. And it will only mean that more and more people become depressed or stressed or anxious and get referred to our service. And then after a few sessions, then they either feeling a bit better, but that same merry-go-round, the fundamental causes of mental illness and stress doesn't go away. And it's that we need to fix. Thank you for listening, and if you agree with what we're saying, then please consider joining the Socialist Alternative.